We spend billions trying to extend human longevity, optimizing cells, adjusting hormones, and mapping our genetic code. But regardless of those health optimizations, our lifespan is capped by the mechanical failure of the cardiovascular pump. A healthy heart requires a pristine plumbing system. To keep the muscle tissue alive and contracting, the coronary arteries must constantly supply the heart with oxygenated blood. If this delicate supply line is compromised, the entire biological system hits a hard stop. Every other longevity effort becomes secondary to the immediate survival of the pump. The decline of this system usually starts with a single mechanism: coronary artery disease. This illustration shows the reality of atherosclerosis. Lipid plaque builds up inside vessel walls, narrowing the channel and reducing blood flow to the heart. Several drivers accelerate this. We control modifiable factors like diet and smoking, but face non-modifiable risks like age and genetics. Dramatic. Atherosclerosis can compromise your longevity for years before you ever feel a physical symptom. When those narrowed arteries finally struggle to deliver blood, it creates a supply and demand imbalance. This scale shows the heart's central problem. It needs a certain amount of oxygen to function, but the diseased artery can no longer meet that demand. This deficit manifests as angina, chest pain that usually surfaces during physical exertion, when the heart asks for oxygen it cannot get. Patients first encounter predictable, stable angina, triggered by exertion and relieved by rest or nitroglycerin. But the situation escalates to unstable angina. This pain is unpredictable, occurring even at rest, signaling that supply lines are failing and a cardiac event is imminent. Angina serves as a final physical warning that the heart's supply lines are on the verge of collapse. If a coronary artery becomes completely obstructed, it triggers a myocardial infarction, a heart attack. This is a severe, abrupt deprivation of oxygen to the heart muscle. Time is the critical variable. As this timeline shows, if blood flow isn't restored, tissue progresses from temporary ischemia to permanent necrosis. Within 6 hours, the area becomes swollen, and over several months forms a permanent scar that alters the heart's shape. While crushing chest pain is the classic symptom, many patients present differently. Focus on the bottom panel. Women and older adults often experience atypical symptoms, like shortness of breath, extreme fatigue, or altered mental status. Surviving the event is only the first step. The real cost of a heart attack is the permanent destruction of the engine required to sustain a long life. Because scar tissue cannot contract, the heart is left with a weakened pump. This state is known as heart failure, where the heart can no longer meet the body's metabolic needs. In left-sided heart failure, the weak pump backs blood into the lungs, causing shortness of breath, crackles, and frothy sputum. Conversely, right-sided heart failure causes a systemic backup, fluid pools in the body, causing leg swelling, weight gain, and an enlarged liver. This backup can lead to acute pulmonary edema, outlined in these 4 steps. Fluid leaks from the capillaries and floods the alveoli, which physically blocks the lungs from exchanging gases. Heart failure represents the end stage of the cardiovascular cascade. At this point, the focus shifts from achieving longevity to managing daily survival. To track this cascade, doctors use specific biomarkers like troponin. As shown in the diagnostic section, troponin levels rise within 3 hours of muscle death, providing definitive confirmation of a heart attack. Post-event recovery is measured by the ejection fraction, which is captured via an echocardiogram. A normal heart pushes out 55 to 70% of its blood with each beat. A heart in failure drops to 40% or less. Medical interventions can help manage the load. Nitrates are used to dilate arteries, while beta blockers reduce the heart's workload to prevent further damage. Surgeons can also interrupt the cascade mechanically. PTCA stents are used to physically compress the plaque, while CABG surgery bypasses the blocked arteries entirely to restore healthy blood flow. While these diagnostics and surgical interventions are vital, they function as damage control measures rather than foundational cures for aging. Securing cardiovascular longevity is a matter of prevention. The goal is to keep the first domino of atherosclerosis from ever falling. Actionable lifestyle choices protect the arterial supply lines. This education panel highlights the necessity of low-sodium diets, smoking cessation, and strict stress management to keep the arteries clear.
Longevity depends on the active protection of the heart's supply and demand. Maintaining this balance ensures the pump runs without interruption for a lifetime.